Welcome back. You're watching the Global Dialogue, and we're in conversation with the former COVID response coordinator at the White House, Dr. Ashish Jha. Dr. Jha, one of the other things that I want to talk to you about outside of COVID is the manner in which institutions responded. And I know that you're also a believer in the fact that there needs to be a lot more input from different sources so that you can put all of that in play as far as policy making is concerned. You also believe that it is very important to follow process and the need for transparency to really explain why decisions have been made and to own up and course correct if those decisions haven't worked out. In your experience as the White House COVID response coordinator, what have been the big lessons on that front?
Yeah, it's a really good question. Look, we always want to have science and evidence at the heart of policymaking. But the truth is that these are complicated countries. I think about India, I think about America, large, sprawling democracies with many voices, many interests. And policymakers, and I've experienced this certainly at the White House, need to get input from many sectors, not just the health sector, not just from doctors and epidemiologists and public health experts. Those are very important. But you also have to think about the impact of policies on workers, on schools, on just sort of society at large. And if you're going to make policy, you've got to bring everyone along. So when I was on the outside, it often seemed very easy to say, oh, the government should just do this or the government should do that. Inside, you can begin to realize maybe that's still the right answer, but you have to bring a lot of people along. Because in a democracy, you can't just dictate what you think is the right answer. You really have to listen to people, and then you have to come up with a policy that a broad swath of people can live with.
Mm-hmm. Yes, I would imagine that will perhaps guide the way that we deal with future pandemics. I hope we don't have to, but hopefully that will guide the way that we deal with them. But I want to address, you're here in Delhi, and perhaps one of the things that doesn't get enough attention as much as it should is the healthcare burden, the healthcare impact on account of climate change, on account of pollution. And are these things that are being taken seriously at a global level? And what do you believe the adequate, appropriate response needs to be?
Yeah, so this is a fantastic question. Here's my view on this. Climate change probably represents the single biggest health threat facing humanity in the years and decades to come. It will change every aspect of health. I don't think that the global health community, and I don't think the global community is taking climate change seriously enough as a health threat. Of course, we're talking about climate change in terms of temperatures and sea levels and all of those. They are important. For me, climate change is going to be seen and felt by most people through health. That's why I often say health is the human face of climate change. Now, what does that actually mean in terms of what should be done? Obviously, we have to work on the underlying causes, carbon pollution, reducing our dependence on carbon and carbon fuels. But the healthcare system has to start, and the public health system has to start thinking about how does it change delivery? How does it manage the fact that we're seeing more heat waves, more pollution? The combination of pollution and heat waves means more asthma, strokes, heart attacks, new diseases. There's a lot of important work that has to be done in the health and public health system that just isn't as far along as it needs to be, largely because I just don't think people have taken climate as a health threat enough. That has to change.
Are you seeing the approach change to that? And what worries you the most? You talked about, the risk of respiratory linked diseases going up on account of climate change, pollution, and so on and so forth, the risk of new diseases as well. What are you seeing at this point in time? What's visible? What does the data tell us already?
Yeah, the thing that data tells us is climate change as a health threat is not something far in the future. It is happening now. We are seeing, whether it's in India or in the US or elsewhere, we are seeing very different weather patterns. We're seeing more, in the US, we had wildfires that caused terrible air quality for days and weeks. That has an effect. Of course, we're seeing from climate change drought that's leading to mass migration of people. So these threats that we used to think would be 10 or 20 years down the road, they are here today. And we have got to start working on solving those problems and adapting our systems to climate change today. This is not an agenda of something we need to do a decade from now. We've got to get going.
You know, talking about problems that need fixing, let's address the problem of medical debt. And that's a problem that is particularly prevalent in the US. But I also want to understand from your point of view what you make of you know, the sort of foray of private equity into healthcare. Here in India, you now have virtually every large major healthcare service provider with majority ownership that is with private equity. And I don't know whether we fully understand the implications of that. You know, on both these fronts, your views?
Yeah. So medical debt to me is a moral stain. I mean, it really is a moral stain. I mean, if you think about it, you should not have to go into debt if you get sick. This is a problem in the US, about $200 billion of medical debt, including among many people who have health insurance. That's largely driven in the US by the extraordinarily high costs of healthcare, and even a lot of insurance people have to pay extraordinary amounts of money out of pocket. Obviously, we've seen medical debt here in India as well. I think there are some policy solutions that are very important. I have been very publicly for years a very vocal supporter of Ayushman Bharat. I think that is a very important step forward in providing financial protection to poor people of India. I've been a very vocal supporter of expanding Medicaid and doing other things to ensure more and more Americans. Same principle. We've got to get people insured and covered. That's not enough. And then when you see private equity, your second part of your question, to me, that is a symptom. It says you have a health system that is not functioning in a way that is really optimal, and that private equity can go in. Now, sometimes we have seen examples of private equity firms go in and actually clean up a mess, make a health system better. That happens. Unfortunately, those are rare. A lot of times what we have seen is private equity firms go in, really take all the value out of that health system, leave it with large amounts of debt, and leave patients really much worse off in those communities. So that is something I think government needs to look at very carefully and really make sure that when you have those kinds of private equity investments, that ultimately they are leading to good for the health of the population that it serves, and not just benefiting the private equity investors who want to make a quick buck and get out.
So, you know, what would you suggest be the guardrails then? Because, you know, these are private market transactions. These are many publicly listed companies. So the government involvement is limited. So what do you believe the government can do by way of placing any guardrails in place?
Yeah, look, I believe in markets. I believe in, you know, in free markets. But when it comes to healthcare and actually other areas as well, there is absolutely a role for government, certainly on regulation, on making sure that quality is high in these places, making sure that there's financial transparency. I believe that more and more of these private systems should also have as part of their mission serving the poor, making sure that they're taking care of some proportion of people who have, let's say, public insurance or through Ayushman Bharat or others. That all of those things can be safeguards. You know, one of the ways that we manage a lot of these issues in the United States is through really rigorous accreditation of health systems. Medicare demands that hospitals and healthcare systems be accredited. That, I think, can be a very important tool. So there's a series of tools that government has to make sure that these systems are delivering for people while still being part of a market system where they can make money and they can grow and they can do all the things we want private sector to do, but to do it in a way that still is responsible to the citizens that it serves.
You know, an issue that I wanted to get your views on, and this is something that, that I would like to learn more about, is President Biden establishing the first ever White House initiative on women's health research. And, you know, we run a massive campaign here called Future Female Forward, which basically focuses on gender parity. And I don't believe that we've had parity even in the healthcare space as far as addressing the issue of women's health. So how do you look at this, and what do you believe the outcome should be?
Yeah, I was very excited to see this announcement. I think it happened just very recently. And here's why it's important. If you look at the research that is done A lot of women's health issues are under-focused, or just they don't get enough attention, they don't get enough resources. That, I think, is obviously a huge problem. And then when you look at a lot of research studies that are done that address health issues from both men and women, we often don't have enough women as participants in those research. And so the results may not be as clear what the impact of that result is for women. This council, I think, is designed to make sure that the investments we're making in the research infrastructure, that the investments we're making to improve care are benefiting both men and women. Obviously, women are half our population, and incredibly important that they get the benefits of science and innovation every bit as much as men do.
What excites you today in terms of the work that's going on, whether we talk about cancer, we talked about some of the R&D that's being done dealing with women in specific, or what's happening with the vaccines and mRNA. What do you feel most confident about in terms of breakthroughs, and what are you most concerned about today?
Yeah, they're in some ways related. What I'm most excited about is we are entering a whole new era of biology, medicine, and health. And that era is really driven by computing. It's interesting. What we are understanding as computing has gotten more and more powerful, we're able to begin to solve more and more medical, health, and biology problems. And this, by the way, is one of the places where India has a particular advantage because of its very strong computing infrastructure, computing intellectual capability, obviously the infrastructure it has. So that mergence of computing and biology, I think will give rise. I mean, the mRNA vaccine is just one example of that. Will give rise to lots and lots of things. Two concerns. One is I think many countries, I think US is part of this, I think India is very much part of this, not investing enough in investment, in R&D, in research. That is a place that is about future growth, and I want to see greater investments there. And then the second part of concern, always important, is when you get innovations, you want to make sure that as broad a swath of the population benefits. So if we develop wonderful new treatments, but half the population or 2/3 of the population doesn't benefit from it, that is really unacceptable. So making sure we're focused on that equity angle so that everybody benefits from these miracles of science, that's going to be really important.
You know, since you're talking about the miracles of science, let's also talk about the miracles of AI, because that's what the world is focused on today. And in this convergence of computing and medicine, what do you believe the future holds? And do you believe that it can meaningfully address the access and the inequity issue?
Yeah, so AI is like any other tool. It is unto itself not going to be magic, but it is a very powerful tool. A friend of mine recently described it as powerful as electricity. Electricity didn't solve all of our problems, but boy, it gave us new tools and new ability to take on very big challenges. I think AI is going to be like that. It is going to be now up to us. AI is going to end up being in everything, in every part of our lives. It is up to us to make sure that we're using AI to improve the quality of care that doctors provide. If you think about large parts of the country, people who have trouble accessing highly trained providers, let's think about the providers that they do access, whether it's the ASHA, other community workers, the people in the primary health centers. How do we augment their ability using AI? How do we make them much, much better in diagnosis and offering treatment? AI has a lot of potential. It's not magic. It will that potential will have impact on people's lives if we use it correctly. So I'm very excited about AI, but I'm also very sober that it's only going to make a difference in people's lives if we design systems with that in mind.
Well, Dr. Jha, it's been an absolute pleasure speaking with you. Thank you so much for joining us here on the Global Dialogue. We look forward to having you back in India. And thanks very much for sharing your views on a whole host of issues. Appreciate your time.